The NCD Alliance was formed in 2009. We're a global civil society network of organisations in 170 countries. In total, our network is 2,000 organisations. And we were set up in 2009 to really try and elevate non-communicable diseases, including cancer, diabetes, cardiovascular disease and chronic respiratory disease, onto the global health and development agenda. These were issues that were extremely neglected from a political standpoint, had very little resources going to them. So we were established as an alliance that would really focus on advocacy. UICC was one of our founding federations of the Alliance. So it was the Union for International Cancer Control, the International Diabetes Federation, the World Heart Federation and the International Union Against TB and Lung Disease. Those four federations came together in 2009, recognising that they essentially had a shared agenda, common risk factors that are cutting across these non-communicable diseases, as well as fairly similar health system responses that's required. And so those federations, including UICC very much at the helm, said, okay, well, let's start working together and collaborate. We'll be much more effective, we'll have more people power behind our issue, and we'll get much further in terms of accelerating the response. There's lots of successes over a very short period of time, I would say. Some of the main ones are, in 2009, we essentially called for a UN high-level meeting on non-communicable diseases. We were very much looking at the HIV/AIDS response as an example of the importance of that kind of global meeting can have in terms of accelerating the response. It happened in a very, very short period of time, and so in 2011, heads of government, heads of state, met in New York to discuss the challenge of NCDs as a health and development challenge, and essentially adopted a political declaration that includes 22 action-oriented commitments on NCD prevention, control, research and surveillance. And that was really the first time that NCDs was recognised as a health and development issue. It was seen as a head of government and head of state issue rather than purely a Minister of Health issue. And it was very much a turning point for the NCD community in getting political commitment and increasing resources. Following that, a few years later, governments adopted the first set of global NCD targets. The most famous one that most people know is the reducing premature mortality by 25% by 2025. And this is for all NCDs, including cancer, obviously. And again, that was a major turning point because before that, we didn't have any global goals and aspirations really at the global level from governments and the UN. And so that really put time-bound measurable targets at the global level that we as civil society organisations could then track and monitor and review progress. The third kind of major milestone and achievement that the NCD Alliance was involved in was just last year, governments convened again in New York. A lot of our advocacy is focused on the United Nations and the World Health Organization. And governments were essentially reviewing the development agenda that's at the global level. Over the last 15 years, the main agenda has been called the Millennium Development Goals, which really put health very much front and center. HIV/AIDS, TB, malaria, maternal newborn child health, very much key to the MDGs. What we saw was that cancer and non-communicable diseases were completely absent from that agenda, which had a huge impact on political commitment, on resource allocations to low and middle income countries, and to health system infrastructure. So what we had campaigned for a 3-year period was, okay, as governments review what should come next after 2015, what should be the post-2015 development agenda, we were making sure that cancer and non-communicable diseases were going to be seen as a priority. So UICC and the NCD Alliance and all of our federations and organisations in 170 countries worked very hard to make sure that we were on this new agenda. And so just last September in New York, governments adopted the Sustainable Development Goals, the SDGs, which are now for the next 15 years. It's 17 goals, 169 targets, 230 indicators, an extremely complex agenda. But the most important point from a cancer and NCD perspective is that we've now got a specific target on reducing mortality from premature mortality from non-communicable diseases, including cancer, which really opens up interesting new doors for new partnerships, new actors to get involved in our area, and potentially new funding streams. So to get involved in the NCD Alliance, you can obviously visit our website, which is www.ncdalliance.org. And that's really a kind of hub of information in terms of what's going on from a policy perspective on NCDs, as well as specific areas that organisations can get involved in. Civil society organisations can become part of our network fairly easily by going to our website and filling in a form. And by getting part of our network, becoming part of our network, what happens is that you're then regularly receiving information and news from us, as well as getting invited to our online webinars that we hold every couple of months, which provide the kind of most up-to-date, cutting-edge information, as well as also having opportunities to get involved in country-level programmes that we're increasingly doing.